On the surface, a depressed brain looks much like a healthy brain, but inside the differences are unmistakable. During depression, the brain isn't operating at full strength in the area responsible for emotion. Think of it as the brain's emotional control center. The emotional control center delivers signals along the neural pathways to and from the areas of the brain that determine how we act, react, and respond to situations, thoughts, and feelings. In a depressed brain, they've become less active or even inactive. In other words, signals that would normally regulate mood and emotions do not work properly in depression. This affects the brain's ability to naturally decode, evaluate, and react to what's happening around it. Tms Therapy is a safe, FDA-cleared, non-invasive treatment that uses short magnetic pulses to target the exact areas in the brain affected by depression. Stimulating and strengthening these neural pathways, like training a muscle, over time the inactive signals begin firing and reconnecting properly again, and thus restoring the emotional control center.
Hi, I'm Dr. Kurosh Edalati, the Medical Director for Illumine Centers for Brain Excellence. At our center, we create hope and healing by helping you achieve your optimal brain and mental health through our innovative and state-of-the-art integrative solutions. Welcome to Illumine and enjoy your journey. How many sessions can one expect with treating depression? Research shows that a minimum of 30 sessions are required for this therapy to be effective. 5 times a week for 6 weeks. The repetition helps reinforce the changes being made to your neural connections. When repeated daily, this helps to maximize the treatment effect. You can expect your first treatment session to be 1 hour. The subsequent sessions are 15 to 30 minutes. After the main treatment is complete, some people may need maintenance therapy, and that can vary, whether it's more TMS sessions or you transition into other therapies at our center. What does TMS feel like? When the pulses are delivered, you may feel a tapping and tingling sensation on your skull, and your facial muscles may twitch on the side of the head that is being treated. What are the success rates? Today's clinical results show that about 80% of patients respond successfully, and 1 in 3 gain total remission from their symptoms. What is the care process? If you have a psychiatrist you're working with, they can refer you to our Center for TMS treatments. If you don't have a psychiatrist, we offer therapeutic assessments so we can personalize your treatment plan and screen for contraindications. As a part of your TMS treatment plan, we include a QEEG brain map to clearly visualize, analyze, and record your brain function to have a comprehensive review of 55 sites of your brain and find out if there are any underlying conditions. Doctors review your brain map and assessment to come up with your TMS treatment plan. Are there any side effects? It produces few to no side effects. Some people may experience scalp tenderness or a mild headache. However, if required, these can be easily remedied with over-the-counter ibuprofen or acetaminophen, or we can make changes to your protocol to alleviate. The most serious known risk of TMS is seizure, which is extremely rare and part of the Illumine assessment screening process and our brain map, which will alert us of that potential ahead of time. Outpatient procedure. After a TMS session, you can resume normal activities for the rest of the day, including driving, returning to work, or other planned activities. Is Illumine's TMS covered through extended health benefits? If you have extended health benefits, this can potentially be covered under psychological services.